one new project, and that is dealing with the early detection of lung cancer. And this is obviously lung cancer is a massive problem because it's firstly widespread over the planet. People get lung cancer. There are over 2 million people that are getting diagnosed each year. And unfortunately, most of them die. So it's really the vast majority of them die. And you can have the best longevity protocol in the world. If you get the cancer, that's it. And if your cancer is detected too late, that's it. There's not much we can do. There are no drugs for it. If you're, and this is a massive problem in lung cancer, because usually when people go into the clinic, they have some chest pain or whatever is going on. They're coughing. They're going to the clinic, and then the doctors find out, oh, sorry, but you have lung cancer. And at that stage, usually the cancer spread already around the body, and it's just too late. So what we have to do is, what is urgently needed is an early screening mechanisms that helps people to find the cancer at such an early stage that it's still treatable. And we know that if you catch it early on, like we have several stages in lung cancer from 1 to 4. If you catch it in phase 1 or stage 1, the chances of survival are fantastic, like over 90%. If you catch it at phase 3 or 4, it's almost zero. So what we are doing now is basically we want to see how can we use our AI to screen for early lung cancer indirectly. So we partnered up with Aerion Biosciences. That's a Dutch biotech, and they work on a 6-protein marker panel that can detect early lung cancer, but it's still in a very early development. And so basically we partner to see if we can use information that they get from their measurements, like with immunochemistry in blood or with mass spectrophotometry from blood samples. Can we use this data to make even a better judgment if a person has cancer or not, or even another lung disease? There are several other diseases that could, in the early stages, look like lung cancer, but there aren't. Or you have to distinguish between cancers that are actually benign and the really dangerous cancers. So not every person that has some nodule in the lung needs to be treated. A lot of them they will be fine. But by understanding the data behind it, so we can make this massive difference. And that's where we go in. So we try to build basically a platform using the AI capabilities that we have at Rejuve Bio, and helping them out, getting their data, putting this all together and see how we can build a platform that helps doctors finding lung cancer early in their patients, and then see what can be done now. And of course, I think this is something that if this works out, and we reach that point in a few years, screening for diseases like lung cancer, but not only that, there are also other diseases you don't want to get, as part of your longevity routine, your longevity lifestyle is super important, and we should go there. So not only focusing on drugs and supplement and healthy lifestyle, but also on screening mechanisms that are evidence-based and that can tell you, look, watch out, you may be in danger of getting disease A, B, or C.